Um, Hi, everyone. Thank you for joining us. I'm Lydia Zalowska, for those who haven't met me yet. I have a great pleasure to introduce our speaker today. We have Dr. Richard TEDESCHI, PhD, with us today. It's been a long journey to get him here. We initially wanted to have Dr. TEDESCHI as a keynote speaker at our CME conference 2 years ago, and then we're not able to do that. Then the pandemic happened. And so we're just very happy that we could still continue the dialogue and bring him back here now when this topic of post-traumatic growth is so relevant. Just to tell you a little bit about Dr. TEDESCHI's background, he's a professor emeritus in the Department of Psychological Science at the University of North Carolina at Charlotte, and the distinguished chair of the Boulder Crest Institute for Post-Traumatic Growth in Bluemont, Virginia, where he has been one of the developers of programs based on the post-traumatic growth principles to help combat veterans and first responders. He has published several books and numerous professional articles on this area. It's an area of research that he developed while at the UNC Charlotte. Dr. TEDESCHI serves as a consultant to the APA, the American Psychological Association, on trauma and resilience. He's a fellow of the Division of Trauma Psychology and the Division of Psychotherapy, and is the past president of the North Carolina Psychological Association. So I'm really happy to have you here, and look forward to hearing about this really, important and interesting topic.
Thank you very much for that introduction, and I'm very pleased to be part of this grand rounds today. I'm going to start sharing my screen to put the slides up for you to look at. So hopefully this goes well. Okay, hopefully we are all good, so you can see that.
Yep, looks good.
Okay, excellent. I passed the first test of this presentation today to get that right. All right, so thank you very much for attending. I thought that first thing I would do is just give you a little bit of an idea of where I'm coming from, quite literally. Boulder Crest Institute is an organization I've been associated with for about 5 years now. And it's a very wonderful place. And it's been great for me to move from the university and my duties there to work with Boulder Crest, because there we've been able to apply the post-traumatic growth concepts I've been doing research on for decades and see it really work in practice with combat veterans and first responders. It's a beautiful spot, and it's got great staff, and we're really dedicated to helping these folks who have trauma histories. So this is a little look at what Boulder Crest looks like from the physical standpoint. So it is in the foothills of the Blue Ridge Mountains, about an hour outside of DC. And it was built on property donated by a Navy veteran, Ken Falk, 20-year Navy veteran in explosive ordnance disposal, who after his retirement did some contracting for the Department of Defense, and then was able to turn those funds into this place. And he had been visiting at Bethesda and Walter Reed many of the military service members coming back from Afghanistan and Iraq with terrible injuries, and he wanted to do something more. And he recognized that these people and their families were suffering from a great deal of trauma and tried to figure out, is there some better way for us to help them? So he established this, and then shortly thereafter, Ken and I had a meeting, and he learned about what I was doing with post-traumatic growth, and we've been working on developing programs ever since. So one of the things that's so wonderful about this place is its beauty. It's in a rural environment, very peaceful, very calm. And it has all sorts of facilities that we use for programming that's a little different from your standard psychotherapy. As you can see there, the kids with the horse, we have horses there. We have kayaking. We have an archery course. We have all kinds of outdoor activities that we use to teach people about managing their trauma history and their trauma symptoms. So I'll talk a little bit more about how that program works. We also have another facility in Arizona outside of Tucson. It's in the high desert country in the Coronado National Forest. This ranch has an old history going back into the late 1800s. We are using this property, purchased this property to provide the same kind of programming out in the western part of the country. We also have several other associated retreat centers that we train their staffs, and they deliver our programming. And we have centers in South Carolina, Georgia, Florida, Arkansas, Colorado, Maine, various places that have similar kinds of facilities that work with our programming. So all of this is based on the post-traumatic growth concept. And so today I want to work with you on learning how we can think about trauma in different ways, and how we can intervene in trauma in different ways than what we conventionally see in most therapies and most institutions. So we're going to think of a new way of defining trauma, a little different from what you find in the DSM. Some different ways of intervening post-trauma, which can be integrated with conventional therapies, but are a little different. Considering what our role is as helpers versus the conventional therapist role. And for example, at our facilities where we deliver our programming through Boulder, Crest, it'd be interesting to note that it's all peer run. We have no mental health professionals delivering these programs. It's all done by veterans and first responders who have gone through the program itself and who we've trained to be facilitators in the program. So very different perhaps than what we're used to in conventional therapy. And we want to pay attention to different possibilities post-trauma, not only the symptoms of PTSD that we're used to focusing on. So getting right down to the business of defining what post-traumatic growth is, for those of you who might not have heard about it, it's a way of describing how people transform, and we use that word transform very deliberately because these are significant changes that can occur to people in the struggle that they go through in the aftermath of trauma. And I've italicized struggle because I want to also emphasize that this is no easy task. That the aftermath of trauma is often a terrible time of a lot of suffering and difficulty. And it's through the struggle with all of that that these transformations, these changes we call post-traumatic growth can occur. So what is the struggle about? And this is where we get into a new way of thinking about what trauma is. So people struggle to rebuild challenged core beliefs. We all have a system of beliefs that we utilize every day, sort of in the background of our minds, to help us understand ourselves and the lives that we're living. We don't pay much attention to these beliefs because they're just so fundamental. We think actually that they represent the world as it is. This is just the way things are. And traumas are incidents that challenge these assumptions that we're making. So we're defining trauma as anything that challenges the core belief system, that makes us stop and reconsider these beliefs. This is based on a work by Ronnie Janoff Bowman at University of Massachusetts on the assumptive world. And other people have also talked about this kind of concept of the assumptive world, this system of core beliefs. And when the assumptive world is challenged or shattered, that's a traumatic experience. It generates a lot of confusion and anxiety for people and produces some of those symptoms of trauma that we're familiar with. But in the aftermath of this challenge to the core beliefs, in the struggle to re-understand things, growth can occur in individuals. And also a similar sort of process we can see in organizations and even larger societies, that when core beliefs no longer seem to make sense and they have to be reconsidered, then we see growth, and it goes sometimes beyond the individual. Now, of course, we've all been going through this pandemic. It's a worldwide phenomenon, as we know, but certainly it's something that's very close to home in some of our families, in our communities, in this country and beyond. So the pandemic is a shared trauma in a way that certain core beliefs may be challenged at the individual level and beyond. And this provides an opportunity for post-traumatic growth in all these areas. Now, the core beliefs are focused on oneself and who we are, or a personal identity. They're focused on the world around us. They're focused on our own future or what's going to happen in our lives. So we all have beliefs about our life path, where we think life is going. And traumatic events are the ones that shift us off that life path, that provide obstacles to this future that we assume we're living into. And they may completely derail what we think of as our life's journey and our aspirations. These traumatic events often shatter beliefs about the world we live in and what other people are like how benevolent are people, how predictable are events, how controllable is the world we live in, and what happens in our own lives. We also have beliefs about ourselves, the kind of people we are, whether we're strong or vulnerable or good or bad. For the military service members that we work with at Boulder, Crest, some of the beliefs about self that are questioned at times have to do with morality. And in the military psychology literature, there's been a lot of attention paid in very recent years to what's called moral injury, where people have to face up to the fact that they've witnessed or been involved in acts that are counter to their moral code. So this is an example of how beliefs about the self can be challenged. And so these kinds of core beliefs are not usually questioned or considered, at least deeply, as until trauma happens. And then it's actually important to shine a light on these things and ask oneself, what's going on here? What's happened to me? What happened to the world I thought I had? And to start to build a system that accounts for what's happened and may do a better job of of leading us through events that are in our futures. So one way we can think about the core beliefs and the shattering of the core beliefs is like a psychological earthquake. Like these traumas are seismic events. And just like an earthquake can shatter the infrastructure of a city, the roads, the electric grid, the buildings, traumas shatter our psychological infrastructure, this core belief system. And so we have to rebuild, just as we rebuild a city, and rebuild these core beliefs in a way that they function better in traumatic instances, just like we hope the city could weather another natural disaster in better shape. So post-traumatic growth then that can occur because of all of this tends to revolve around 5 different types of growth. What Lawrence Calhoun, my colleague at UNC Charlotte, and I did when we first started researching this area is we did a lot of interviews with people who had suffered physical disabilities in adulthood, older people, bereaved people. And from those interviews that we analyzed, we created some quantitative measures of growth. And through our examination of the items on these measures that were taken from the interviews, we found that there are 5 different areas of growth that people tend to report. And these 5 different areas show up across cultures. Our quantitative measure of growth has now been translated into over 24 different languages, and it's been used in many countries around the world. And these 5 areas tend to be common reports, no matter what kind of culture you're talking about. So one area of change is relationships with others. This is where people talk about how they are emotionally closer, or more compassionate, more empathic in their relationships, maybe disclose more, that the relationships have improved in terms of their depth. Another area is new possibilities. This is where people say that life has taken them on a different course and there are opportunities that are available that they wouldn't have considered otherwise. Another is personal strength. This is where people say they recognize they're stronger than they thought they were, or going through the aftermath of trauma has strengthened them, or they report that if they've gone through this, they feel like they can handle anything. Appreciation of life represents a savoring of life in a way that hasn't been done before, or a gratitude for things in life that are taken for granted. And then there's spiritual and existential change, where people address their spiritual beliefs, sometimes religious beliefs, strengthen them or change them in some way, or find themselves focused on existential issues about their purpose in life, the meaning that life has for them, why they're living the way they are, the degree to which they feel connected with humanity or people who are different from them. So these are 5 areas of growth, and there's a lot of variability in how people report post-traumatic growth. Some people will report change in one area only, maybe other people report all 5, different degrees of change. So there's a lot of individual differences in all this. So in order to facilitate this growth process, Lawrence Calhoun and I developed a model for working with traumatized and bereaved persons that we called expert companionship, as a way of sort of describing the approach or kind of relationship that we think is very helpful for trauma survivors in order to facilitate this post-traumatic growth process. Now, the process of post-traumatic growth is a naturally occurring one. Virtually all the research we did early on was with people who did not have psychotherapy. They weren't encouraged towards post-traumatic growth in any formal way, but somehow they moved in that direction. And we discovered that very often they moved in that direction because they had some kind of support from people around them that were experts at being companions with them in the aftermath of trauma. Special people who were particularly good at being companions. And this facilitated a growth process. So expert companions provide comfort and support, ease loneliness and isolation, and they can help facilitate changes in core beliefs. So expert companions can be professionals, but not always. In fact, not usually. They can be other family members, they can be teachers, clergy persons, coaches, other people in the community that people come in contact with who respond well to their needs for support in the aftermath of trauma and who can see possibilities for positive change. Now, as mental health professionals or health professionals, we can certainly operate as expert companions with the people who are traumatized that we come in contact with. So if we are patient and humble and attentive listeners, we're likely to be good expert companions. Humble is important here. In the audience here, I'm sure there are people with all kinds of graduate degrees and whatnot. And we can start to assume that we know a lot. But we find that when we're working with trauma survivors in their particular circumstances, it's important to realize we don't really know much about that person that we're working with. They need to teach us what's happened to them and what it's been like to go through what they've gone through, rather than us making assumptions about their experience and what they need. So this kind of humility in approaching trauma survivors is really important. And also being patient in tolerating the process of change, which is sometimes very slow for survivors of trauma. And so we have to be attentive listeners to learn what the person is going through, the steps involved for them, and also paying attention to the positive changes that are starting to occur that will flower into post-traumatic growth if we are good facilitators of this process. So the expert companion has expertise in high-quality interpersonal interactions. These are people who are tender, who are capable of being empathic, who understand the pain of trauma, who resist the temptation sometimes to give advice that is not connected up well with the experience of the trauma survivor. So this is a person who knows how to offer these kinds of high quality interactions. Now, for those of us with education in this area, that includes listening to trauma survivors and learning what it's like. You also get a knowledge base that allows you to understand something about the trauma process and the aftermath of it. But at the same time, allows you to realize that you don't have many answers to a lot of the questions that trauma survivors are grappling with, especially a lot of the spiritual and existential questions that may come up. And in addition, the expertise about trauma and loss that allows you to be a companion, a good companion, includes things like realizing that there are no time limits on how long it should take for someone to move through a process of growth in the aftermath of trauma. Of course, this is where we run across things like in the DSM where, you know, complicated bereavement starts to happen in a certain number of months after a loss or something like that. This is not really helpful when you're working more personally with people, and so we want to lay aside a lot of those kinds of assumptions and pay attention to a person's individual experience. And of course, there are the old ideas about stages of grief and things of that kind, which make it seem like there are a particular series of events that people are going to go through in a well understood way that allows them to be healed from their trauma. And it's messier than that. And so talking about stages of grief and things like that is not really helpful with people because there are great individual differences in trauma response. Another thing we want to resist is the idea that there's going to be closure. And in fact, research shows that people who suffer loss continue to be attached to those who they've lost. That is the commonplace experience. So people still have a relationship with those who have gone before them. And so in our work with military service members, for example, veterans, when they're referring to comrades that have died, they think a lot about them. And they have a lot of different feelings about what's happened. Sometimes that they failed them, they wish they could have saved them, that they want to honor them. There are all kinds of attachments that are still there. There's not a clean closure on these kinds of events. There are alternatives to talk. We're used to using our talk so often in our psychotherapy that it's sometimes easy to overlook that there are other ways to express emotions, and some of these ways that we use at Boulder Crest involved a lot of physical activity. And we also have to recognize that in re-understanding one's core belief system and coming to terms with what has happened, this is a process that can lead to post-traumatic growth. It's actually very, very useful to downplay the idea that you're in the expert role when you're working with trauma survivors, because every trauma and death is different, and it's hard to really know what's happening with an individual person. So you have to allow them to tell their stories, take the time to listen, and recognize that people are experts on their own experience. They know themselves and what's happened to them. You got to listen to their understandings of some of this. And there are great cultural differences that are important in trauma and grief, how it's expressed, what people assume about it. So understanding their culture is important. And I use this idea of passing on what's been learned by others very often, because there are a lot of traumas I've not experienced, thank goodness. So I'm not going to act like an expert in these matters, but I have talked to a lot of people who have gone through these things. So sometimes I might say, I've heard this kind of story. How does that play out with you? Or someone else told me this. Does that apply to you as well? So that's a good way of conversing about trauma when you don't have your own personal experience. So all of this takes the pressure off of you to solve a problem that is usually not solvable. So the expert companion listens to the worst, some terrible stories you have to hear. You learn from the survivor of the trauma, and you're able to tolerate some of the things that seem crazy. And I worked for 25 years for a nonprofit in Charlotte that serves bereaved families, and I did weekly support groups for bereaved parents. And these bereaved parents over all those years taught me a lot about trauma and grief, because losing a child can be considered a traumatic loss. And for example, they told me a lot about post-death encounters with their children and things like that. I've heard all these kinds of stories, and they may sound hard to believe, but you have to understand that people are telling you about their experiences that they believe in. And of course, trauma survivors often feel crazy themselves because they're having reactions and experiences that they've never had before. So being able to be open to experience is really important. And you can be there for the long haul in many circumstances, maybe not all, depending where you work, how things are structured, but try to be there for the long haul, because post-trauma is usually a long haul thing. It's not resolved quickly. So now about 5 phases of trauma response that we use in our post-traumatic growth model, and that we apply at Boulder Crest. And in the middle, we have trust and connection. That's the expert companionship thing that I've been describing to you. A relational model of post-traumatic growth intervention is what we really have here. It's based on the concept that the relationship that you have with the trauma survivor is of crucial importance. Without that trust and connection, you can't really do much. This is, in a way, nothing new in the literature of psychotherapy. The psychotherapeutic relationship has been discussed for a long, long time, many decades, as crucially important. But in recent years, we've tended to get away from it because we focused a lot on manualized models of therapy that have certain kinds of steps and sequences involved, without as much concern about what kind of relationship we have with a trauma survivor. So I want to emphasize the fact that the relational part of things is crucially important. And around this relationship, and through this relationship, we can engage trauma survivors in these 5 different areas that are important. And we've got it kind of laid out here in a circle to try to emphasize the fact that it's not linear, it's not mechanistic, that all these things are iterative and play back on one another. But for our purposes, we're going to start with the top one, education. And we're going to see as we do this, that there are connections between this model and what we have in a lot of the conventional trauma therapies. So this is an approach that you can start to integrate into your standard conventional approach to trauma treatment that you've been engaging in. So in most trauma treatments, especially the cognitive behavioral treatments, educational is an important component. Now, the education is about why people are having the responses to their experiences that they're having. There's certain physiological response, why they have a startle response, why they're having nightmares, and why they're hypervigilant. And when you start to tell people that this makes sense, that they are responding to current circumstances as if they're still in danger, and this self-protective response is a naturally built-in and naturally occurring way to survive, it starts to make sense to people, and they feel less crazy. They feel like, oh, there's an explanation for this. Somebody understands these things that just coming out of the blue and don't seem right to me. We also want to educate, however, about the idea of the core beliefs, that one of the things that's really distressing to people, anxiety arousing, is they don't know what to believe. The old beliefs no longer hold. And so we tell them that everybody's got a belief system that's helped them understand their world. And given what you've been through, this is up for grabs. It's all confusing and it needs to be reconstructed. And that's why you've got a lot of the anxiety you have, because you don't know what to believe anymore. The world doesn't make sense. So you educate like that. Another part of the education that's really important is to, and we do this with our combat veterans, we tell them that there's nothing wrong with you, it's what happened to you. Making the distinction so that people don't continue to feel like they're broken people. Instead, they realize that they've been exposed to terrible circumstances, and that's what's happened. It's not that there's a defect in their character or that they're not strong enough. It's that they've been exposed to terrible circumstances. And this is what happens when people are exposed to those circumstances. They're not broken. So just like a car alarm that's going off in a parking lot and nobody's around, their alarms go off when nobody's around. That means the alarm system's working great. It's just that it's overly sensitive, or there's something wrong with the triggering mechanism. That's what we have to address. We have to help them start to see that there's a safe situation for them. They don't need to be alarmed. And our trust and connection helps to set in motion that sense that, oh, there can be safety in this world. Another thing that we need to help people with is emotional regulation or distress tolerance. And again, this is something that happens in most of the conventional CBT approaches to trauma. And so emotional regulation we can help with through two different ways. One is through activity, physical activity, because that helps use all that anxiety and intention and focus it and challenge it on some physical activity which feels better, and also calming mechanisms. So at Boulder Crest, for example, we teach meditation and help people learn other ways to calm themselves. That's what our archery range is about, for example. To shoot an arrow accurately, you've got to still yourself and be really calm and focused. So we're teaching them archery, but they're learning emotional regulation. And when they get that connection, they say, oh, it's like, oh, okay, archery was fun, but now I see I can apply this in my life every day. We of course, want to encourage constructive disclosure. Without disclosure, it's hard to do much of anything with trauma histories. Now, in conventional treatment, the disclosure tends to focus on the traumatic event. For example, in prolonged exposure therapy or even cognitive processing therapy, there's a lot of focus on the traumatic event. Even in EMDR, even though it might not be said out loud to a great extent, there's a focus on traumatic events. In our work, we have learned from the veterans and first responders we've worked with that actually some of the things we assume to be important in this process are not important to them. Sometimes combat traumas aren't what they want to talk about or they think is all that important. There are other things that they need to disclose about. And so we need to understand from people what kind of disclosure and about what is important to them. Not assume that, okay, you had this traumatic event happen. Let's have you repeat that story over and over again until you are desensitized to it, like you have in prolonged exposure. That kind of disclosure is not necessarily what we're going to be going for. And in fact, a lot of what we talk about is not the traumatic events themselves so much as the aftermath of the event. We're focused on the aftermath. That's what we're encouraging disclosure about. What is it like to live with this? What is it like to live with the things that happen to you? Where does that put you? How do you think about yourself? How do you relate to other people? How do you run your life? What assumptions do you make about your own future, given what's happened? So we talk a lot about the aftermath of trauma because the struggle with the aftermath is where the growth occurs. So we focus a lot on that. In our Boulder Crest programs, we do everything in groups. And that mutual disclosure is very, very powerful. When people find out, oh, I'm not the only one. And that allows for another bond of trusted connection to occur with the other members of their unit that they go through this Warrior Path program with. And then out of those disclosures about things that happened in the past, particular traumatic events, the aftermath of trauma, all of these different things, people start to create a coherent life story, a narrative, which starts to make more sense out of who they are and what happened to them. One of the things about PTSD that we see is the memories and the experiences that people have are just fragmented. They're not well integrated. People are confused about who they are, what they went through, what this all means. And we got to help people create a coherent narrative out of all these pieces, put these puzzle pieces together so they can start to see who they are. And the important part of who they are, again, is this future orientation. Now, where are you going? What happens next? What different chapters can you write in this story? Can you imagine these different chapters? And what do you need to do in order to move towards one kind of outcome or another? So we want to create this life narrative, which helps people feel like, oh, I make sense to myself. All I've gone through has led me to where I am today, and hopefully oriented towards a certain kind of future. And that future should involve service. So this life story leads to acts of service. All of what people go through in traumatic events can feel like just useless, meaningless suffering if they don't learn something important about living life through all this. And so we help them face up to the tough lessons that they've learned about themselves, about living in this world, about what it means to be a human being. So they can take that and figure out, can I benefit other people in some way now that I've gone through all of this? Let this not be in vain. Now, at Boulder Crest, a lot of the people that we work with are used to being of service. They're first responders and military service members. Service is important to them. They get the concept. They get the concept of mission. That word mission we use a lot. And we ask them, so what's the next mission? What's going to be the mission for you in living your life? Who are you going to have a positive impact on? And by talking about this, they start to realize again that they're not broken, that they're of value. And even if they remain diagnosed with PTSD or some other kind of psychiatric disorder, that doesn't mean that they can't function in very important ways in life. They may still have symptoms, but the symptoms can be tolerated when people know that they come out of experiences that they can learn from and turn into something valuable, not only to themselves, but to other people, their family members, their friends, their neighborhoods, their communities, their country. So what way can I be of service? So in our programs, before people leave our week-long retreat, we have them develop a plan of service. And then we follow them for up to 18 months later with video chats and other kinds of resources we present to them online. to try to support this process of turning all of what they've been through into a life that's meaningful, so that their suffering isn't meaningless suffering, so their suffering has some value to it. And that makes it much easier to tolerate. In the process, as we support them over months, up to 18 months, we provide support. There is still a need for education about what they're experiencing. They need to maintain their emotional regulation processes and continue to practice the things that we teach them about managing their emotional responses. They still have to be able to talk to people in some way about what they're going through. People from their unit that they go through in our program or others. They still have to be aware that they're living out a story that they have some control over, and that story involves being of service to others, where they can feel proud again of who they are and what they do. So, thinking about the pandemic that we've all been through, what can we do to apply some of these ideas there? Well, we can listen for what people are saying about their needs, their responses, their experiences. In my psychotherapy work, I've been hearing a lot about what the pandemic has been like for people. And people have very different experiences of it. It's not all the same. Someone told me it's like we're all in the same storm, but in different boats. So we got to learn what it's like in a particular boat. And we can start to also think about not only individual, but organizational and social adaptations that could be useful going forward. And so I'm sure we're all aware of some changes that are going on in the organizations that we're in contact with or work for. And we see changes in our society. And some of these changes could be really positive and can be developed into some more useful ways of living and doing things. Now, vulnerabilities as well as strengths are revealed in all of this. And the fact that there are both vulnerabilities and strengths acknowledges that this post-traumatic growth concept and all these processes are inherently paradoxical. That is, out of vulnerability comes strength, out of loss comes gain, out of grief comes gratitude, out of feelings that you need to find support and have someone help you can come a greater sense of strength. So appreciating that paradox and engaging in that kind of dialectical thinking allows people to see possibilities for themselves, see the strengths that they can move towards and develop, and the possible futures that they have, new possibilities in the wake of this pandemic. So what you need to do to facilitate this growth process for individuals and groups is, first of all, you have to act interpersonally. You do have to be an expert companion, no matter what level you might be working on. You have to be someone who is open, who is a good listener, who is humble enough to realize that you don't have all the answers. So act interpersonally in these ways, in your family, in your community, in your organization, in society, and that can help promote positive transformations. And in doing this, maybe the pandemic is less overwhelming because you can sense the ways that you are acting to kind of move things in a positive direction among the people that you have contact with, either very closely and interpersonally and proximally, or in a more distal way, by the way you are thinking about this and acting in the aftermath of these terrible months that we've been through. So listen and learn from the other people who are going through their own experiences with trauma, so that you're an expert companion who promotes trust and connection, so that other people can get the feeling of, hey, what it's like to be around someone like you, and maybe aspire to be more like you and how they interact with those around them who are also struggling. Here's another thing to consider about this whole process of post-traumatic growth and expert companionship. It really provides a lot of satisfaction, because you can sense your purpose and that you make a difference. And it provides a perspective of gratitude for the life you're living, even if you have your own troubles. You listen to some of these other folks and what they're going through, and you can say, well, at least I'm grateful that I'm not going through what they're going through. And you can also start to learn about the strength and remarkable capability of trauma survivors as they go through their particular circumstances. And they often provide wisdom for how you can live your own life. I've certainly found that in my career, that the people I work with have inspired me in ways and taught me a lot about living well and what's important. This is a book that myself, Brett Moore, and Ken Falk and Josh Goldberg at Boulder Crest published a year ago, where we did interviews with people who are associated with military service in some way. So these were former military service members, or their spouses, or their parents, or their siblings who had been touched by traumatic events. We interviewed them, and those parts of those interviews are in this book, where they tell their stories, and we talk about how these stories illustrate this post-traumatic growth process. So it's meant for a more general reader and illustrates how trauma can be transformed into growth. And this particular image on the cover is a representation of a Japanese art form called kintsugi, where pottery is broken and then mended back together with precious metals, showing that what is broken can be beautiful in its healing, in its mending, which is a nice metaphor, I think, for post-traumatic growth. So here are some contact information. If you want more information about post-traumatic growth, we have a lot of resources at our Boulder Crest website. You can download articles and all kinds of stuff there if you're interested. And that's my email address if you want to get in touch with me personally. So with that, I'll stop sharing these slides, and I guess it's time for questions and answers.
So thank you very much, Dr. TEDESCHI, for your presentation. We do have a couple questions, and if anyone else would like to ask a question, you can put it in the Q&A section. I had just one question that I'd like to start with, is to think about the spectrum of trauma responses that people have. That can vary from some responses, but not PTSD, to PTSD, full-blown PTSD. And I just wonder if you can comment on the possibility of post-traumatic growth, depending on where you are on that spectrum.
Great question. I want to preface my answer by saying we have done a lot of research on this. If you haven't heard about post-traumatic growth before, you might be surprised that there are hundreds of studies on this now. And we published a book back in 2018, myself, Lawrence Calhoun, my colleagues Jane Shakespeare Finch and Kanataku. which summarizes this research, and we have about 700 references in that book. So we've actually seen that there is a good answer to this question. And it looks like there's a curvilinear relationship between the amount of distress that people experience and the amount of growth that they report. So if we imagine an inverted U-shaped curve, at one end, we have people who show very low post-traumatic growth because they don't have much distress. If there's not much trauma, there's not much challenge to the core belief system, there's no reason to change anything. So there's no growth. On the other end, there are people who show low growth because the distress is so overwhelming that they don't have the emotional regulation, or they don't have the capability of managing well enough to start to make sense of what has happened to them and go through this process. So if the distress is too little or too much for an individual person, you show low growth. But in the middle kind of range, where there's a significant amount of distress, but people can start to develop emotional regulation processes and start to develop ways of understanding what they've gone through, like the education and regulation processes, and they have a supportive enough network they can disclose, they can start to do all that, then you see maximal growth there.
Great, thank you. I have one question here that's asking to differentiate post-traumatic growth from resilience, and how is the post-traumatic growth work, different from identifying resilience promoting factors?
Okay, so let's go back to what I was just saying to you. So the people who show low growth are resilient. That is, they're not particularly affected by an event that may to the outsider look traumatic. They are able to recover quickly. They bounce back from this. They're resistant to this adversity. That's what resilience is. Resilience is someone who can absorb the impact of something without getting out of shape. So people are highly resilient, show very little post-traumatic growth. Now, let's think about the other part of this, and that is, as a result of going through a process of post-traumatic growth, what do we see? What kind of changes we see? We see a greater appreciation of life. We see greater sense of personal strength. We see better relationships. We see these kinds of things that start to look like resilience, right? So we can think of post-traumatic growth as a pathway towards greater resilience. So people in the aftermath of these events and the struggle towards post-traumatic growth are in better shape to absorb traumas in the future. They create a core belief system that allows them to navigate future difficulties with more success. They become more resilient.
Very interesting. There's one question or comment that in developmental work, the expert companion is usually a parent or caregiver. As the clinicians, we can deliver treatment to parents or systems like schools. So is there an analogous way to support the companions of a trauma survivor so that they can best serve as the expert companions?
Yes, absolutely. I think that's what we want to do. The more expert companions we got in life, the better. The more we have in the community, the better. Equipping people to be like that is a good idea. So what would we need to do? We'd have to educate them about trauma response so they don't think things that are not very helpful. We might educate them in terms of how to be with people who are trauma survivors, be with them with some confidence in their capability to manage just the discomfort that can happen being around trauma survivor. See, a lot of people are afraid to be expert companions. They're afraid of the emotion that's involved. I mean, how many people have avoided talking to someone who's gone through who's going through grief and bereavement, right? Say, oh, I just found out his brother died. I don't know what to say. I don't know. This is really uncomfortable. I guess I'll send a card and say, thinking of you, and let it go with that. I mean, it's very uncomfortable for people to be around trauma survivors, no matter what they've experienced. So, our veterans that come home, they get their perfunctory "thank you for your service," and that's about it. For a lot of them, no matter what the trauma is, how about someone who's been raped? I mean, people don't like to talk about that either. It's all these things people avoid. So if we can help people be better expert companions, to not avoid trauma survivors, but to approach them and to help those people be able to express something about their experience and approach their own experience rather than avoid it, then we're going to be going in the right direction.
Great. Here's another comment from Quentin Gabor. How do you incorporate the idea that there may well be growth or something gained from something terrible? In some work I've done with people with advanced cancer, with poor prognosis, it is very likely that they will attain a new understanding of what is really important in their lives, and often will ultimately reflect that it was a gift to learn such. But it's inadvisable to tell them that they will eventually appreciate this growth. So maybe timing of when do you talk about growth?
Yes, timing is really crucial. Absolutely right. So, this is where it's hard to create a manual for something like that. You have to have judgment, and you have to be emotionally connected enough with a person to be able to read that. However, when you think that you may be, well, there's two ways to talk about timing. One is people give you hints from what they report if you listen closely enough. They start to say, they might mention a thing like, now since I got cancer, I've been spending more time talking to my teenage son. So they mention that in passing, and they say, okay, hold on a minute. What's that about? Tell me more about this talk with your teenage son. Why are you talking more with your teenage son? What's the thought behind that? How are you thinking differently than you used to think? You see, then you start to get at change relationships with others. You start to draw that out just from that comment. Listen for how people say something about change, and then expand on that. Have them explain it. Have them explore it, because they may not even recognize it very clearly in themselves, and you want to expand that picture and have them say, you're right. And you know what else I think differently about? I think differently about that. Yeah, not quite the same as I used to be. Tell me more about that. I mean, you work collaboratively, or you're a companion. You're in a companionate relationship. So you're traveling along with them on this, and you're watching what's happening along the way. You say, oh, wait a minute, stop right here. Tell me more about that. So you're paying attention to this, and this is why this is different from conventional therapy, where we're focused on symptomatology. In conventional treatment, we're asking questions about, are you sleeping better? How's your appetite? How are the nightmares? And we're not paying attention to things that we're talking about here as closely. I don't know how many people I've had who have been other places, like the VA, for example, or someplace, and we start talking about these kinds of positive changes, and they say something like, no one's ever talked to me about this part of things before. They just asked me about my appetite. Say, okay. Or somebody will tell me a story about these kinds of things, and I'll say, "You're talking about this like this is kind of new to you. Have you? Why haven't you talked about this before?" And they say, "No one ever asked me. It's just ignored." All right. So just pay attention to those kinds of things. That will help with your timing. And then another thing you can do is what I mentioned earlier about lessons passed on by others. So you can say, and I can say this honestly, this is honest because I've been around a long time and talked to a lot of people. So I say, um, you know, other people have told me this. Is that the case for you? So other people have told me that they feel stronger now than they did before. Is that the case for you? Other people have told me that some of their relationships have really improved since then. Is that the case for you? So I'll introduce this because, I heard this story. These other people told me this stuff. What do you think? Is this the case for you? And that's a way of getting to it without being offensive, and giving some kind of message like, you need to be this way. We're not doing that. We're not doing that at all. And the other thing that's really important in this is to word things in a way where you make it clear that the trauma itself is not a gift. Trauma is no gift. I've gotten emails from people who have read about what I do. I've had a few emails where people have completely misunderstood and sent me nasty emails saying, so you say it's a good idea for people to go to war and get their legs blown up so they can have some post-traumatic growth. What the hell is wrong with you? I said, no, I'm not saying that. Cancer is not a good thing. Rape is not a good thing. Combat injuries aren't good things. We're looking at the aftermath. What happens after that? What do people do after that? And that's what you want to focus on. So I worked with these bereaved parents all these years. I would never say to a bereaved parent, it turns out it's a really good thing your child died. Look at the changes that happened in you. No, of course not. That's ridiculous. So you don't focus on the trauma. The trauma can be a catalyst, but that's not the point. The point is, what do people do in the aftermath? And that's where we come in and we can help.
Thank you. There's one question from Marav Silverman, who is asking about her experience, or sharing her experience, that one thing she noticed when working with veterans is that they kind of have an identity attached to having PTSD. And sometimes, it may be a threat to their identity to talk about growth or overcoming trauma. So just wondering if you have some comments on that.
Yes. Oh, yeah. I understand exactly what you're talking about. And so it is important to not be critical about that, but to help them see their value beyond being a survivor of trauma or having PTSD or having a physical disability or whatever it might be. That's not all who they are. And their value really is in how they can be of service to others. So you try to start to work on what do you have to give, who you are as a person of value for the people around you. That's where the service component comes in. So you say something like, you've always been of service. You've given a lot, sacrificed a lot being of service. But all that you're going through now that is so hard is only a part of who you are. The rest of you as a person devoted to service is still there. And I would like you to start to think about how you can express that now and in the future. So it's not like we're going to ignore symptoms. They're terrible, but symptoms are more easily tolerated when people have a meaningful life to live. we've done a kind of a pilot program evaluation study of our program that we just published a couple months ago in Practice Innovations. And what we found is that even though we're really not focused on symptom reduction in our programs, symptoms are reduced greatly after a week-long stay. And they persist at that low level over 18 months. Why is that? Given that we're not really focused on symptom reduction itself. It's because people start to see that they're more than a collection of symptoms. And the symptoms then aren't so distressing. They're tolerated better. And of course, with things like emotional regulation and disclosure, a lot of the anxiety decreases. And therefore the symptoms decrease. So, and then people start paying attention to something more important about living their lives than paying attention to their symptoms all the time. It's like, I don't have time for these symptoms. I got stuff to do that's important, you know? So there's all these ways in which symptom reduction becomes part of the picture without it necessarily being the direct focus of the programming itself, because we're doing something that is beyond that, that allows people to see their value, have a different kind of focus and direction, and tolerate symptoms better, and be less anxious and be more enthusiastic about living life. And that's counter to those symptoms.
Building on that, there's a question by Rochelle Moen. There's a few parts to the question. One is, are the expert companions paid, or are there volunteers? And are there, as they're being exposed to trauma, are there also some of them experiencing secondary trauma? And how do they protect themselves from it?
Okay, in our programs at Boulder Crest, our expert companions are called path guides, because our program, we call it Warrior Path. It's progressive and alternative training to healing heroes. That's what we call it. And so they're the guides. They've been through the program themselves. We give them training. We hire them. We pay them they are very well compensated. So they're full-time staff. Okay, but they're military service members or they're first responders. Okay, and so those expert companions are peer professionals essentially. But in life, almost all our expert companions are just naturally occurring. I remember I was at a conference one time, a number of years ago. It was a Warrior Resilience Conference. And there were about 500 service members in the audience. They had one of those, those clicker things where you can do polls of people in the audience. They have clickers, you ask a question, they click them. So I did this little poll, I talked about this stuff. And I said, okay, so who's been an expert companion for you given what you've been through? And about 10% of them said some kind of mental health professional or health professional. A very few said clergy. It was like 80% said it was friend or family. Almost all the people that were supportive and helped them were friend or family member. So expert companions are almost always unpaid and not professional, but still have those capabilities for listening, being humble, being there for the long haul, being supportive, seeing possibilities for change, being encouraging in that way, helping people see that they have a life of service to live. A lot of people find folks like that, fortunately. Now, some people don't. So this was a very select group that was at this conference, of course. And a lot of people don't have that good fortune. But that's where maybe we can come in as professionals. And one thing, I treat all kinds of individuals in psychotherapy and whatnot, and that's very fulfilling. But I feel like I have a much greater impact when I'm helping a program like Boulder Crest develop, because I can sort of extend my impact much more widely. Many people, benefit from the training in these areas, so that we got a lot more expert companions out there.
Mhm. I have another question that's maybe related to this is how do you compare your approach with Haim Kohat's client-centered therapy?
Well,
Or maybe
yeah,
even positive psychology ideas too.
yeah. Well, I don't claim that there's anything new or that I've invented in this. First of all, post-traumatic growth, even though I coined the term, has been around ever since there's been trauma. If you look at the stories of the great religions and literature, and there's stories of post-traumatic growth all over the place. This is nothing new. We just happen to give it a name so that we can do research and stuff like that. So that's not new. And this relational approach of expert companionship isn't all that new either. I'm just applying it to trauma survivors in particular, and talking about it in terms of this system, which our research has shown is kind of the system that happens to people when they do well and they show this growth. So for example, when I was in graduate school, my director of clinical training was a student of Carl Rogers, and Carl Rogers developed back in the 1940s this client-centered therapy, saying we got to listen and be focused on the client and all that sort of stuff. That's in my professional bones. So yeah, a relational approach is important. I just think that we have ignored it too much recently in the development of manualized trauma therapies. But there are people out there who are showing with the research, people like John Norcross, for example, who have shown that if you look at psychotherapy outcome research, what's responsible for good outcomes? Relationship more than technique. And are, as good as some of the trauma therapies are, they're not good enough. A lot of people drop out. A lot of people don't want to even get into them in the first place because they don't want to go through like exposure therapy or something like that. Medications aren't all that great. I mean, we're not doing well enough. So we got to keep innovating. We can do better. And that's what we're trying to do at Boulder. We're not satisfied with the program we got, even though our research is showing it's working really well, because we realize, there's still people who need more help than that. So we're trying to create a laboratory for learning better and better how to treat trauma survivors, and not just veterans and first responders. For example, our female veterans that come through our programs, quite a few of them are dealing with military sexual trauma, and that's a specific area that more needs to be done with. And I was talking earlier with one of your colleagues about the fact that we're not usually focused much on combat trauma at all. We're dealing with ACEs very often, adverse childhood events. A lot of these military service members have had traumatic childhoods. In fact, that's one of the reasons they got in the military in the first place, is to get out of the house. So we end up dealing with that. So we're trying to develop programs that help lots of different trauma survivors.
I think
I just want to say also in the healthcare area, I've done some work with a colleague of mine at Wake Forest, Suzanne Danauer, working with cancer survivors, breast cancer survivors, and applied a lot of this there. And so this concept and this process of post-traumatic growth that we've found in our research applies across traumatic events. It's a very similar process and a lot of same outcomes.
Well, what you were talking about maybe just now, applying it across different situations and maybe tailoring it as well. It speaks also to one of the questions. How do you support people who go through that 1 week? Because it seems like a short time. How
Yeah,
the question is, how do you learn to regulate emotions in just 1 week,
yeah,
and what do you do afterwards for the 18 months or maybe even
yeah,
beyond
yeah.
that?
Well, it is surprising. Let me just look here for a minute. Reaching down here for. So here we do have a manual. Okay, it's 200 pages, which lays out 48 modules that are covered in a week. So it's a structured program in a way. There's a lot of ground covered. In a week you've got a lot of time with people, and we have 6 to 8 people in each group that comes through. So, for example, we teach them meditation, and we have them meditate every day, and we help them figure out how to do that and what it's like and all that. Help them practice that. So it's an emotional regulation strategy. Um, we get them by the second or third day. They're talking. We have bonfires at night, every night. We review the day and we sit around and talk. And at the bonfire in the dark, people are sitting around a nice big fire outside there. People start saying stuff. A lot of disclosure happens just there. It's a very kind of informal situation, but some of that disclosure happens there. So, there's all kinds of things we do, and each module is designed to teach something, to teach emotional regulation, to encourage disclosure of certain type, to put things together as a story. And at the end, we help them develop a plan for going home. And what that plan involves are physical wellness practices, financial wellness, because a lot of these people have, because of their problems, ended up in financial disasters. So we help them figure out that. Spiritual wellness, whatever that might mean for an individual, but recognizing there's more to life than just them as individuals. We help them with nutrition. We have them cook. We grow food. We have every one of these places. We have great food. People cooking great food, and they learn how to do it. Healthy, really healthy food. We try to cover a lot of stuff, and then in the months afterwards, in fact, we're in the process of redeveloping and revising what happens in the months afterwards, because we realize that during that 18-month process, that's a long commitment for people. But we try to present them with all kinds of materials and resources to keep them connected with us. And we have staff members call in, and we have meetings with their groups monthly to keep them supported, so they're not feeling left out and abandoned. But we're not doing perfectly well with that. There's still people we lose in terms of losing connection with them. We're trying to figure out what happens with those folks and why, and how we can do better. So right now we're involved in, revising that whole program to make it even better than what we got. So
Thank you.
So it's there's a lot that gets done, and it's hard to explain it. You have to see it in action and see all that we do.
Well, thank you so much for this really wonderful talk, and I love the whole person approach. That even in 1 week, you addressing so many different aspects of the person's well-being.
Yes.
And I really again appreciate you coming to our department. I don't know if Sophia, you wanted to add anything as we're wrapping up.
No, I was going to say, this is so timely. And I as you were speaking, Dr. TEDESCHI, I was thinking, the trauma here in the Twin Cities has not only been the epidemic, it's been the George Floyd murder, which I think has been experienced as a really a collective trauma on many, many levels. And of course, affecting different sectors of our community, with different depths of injury. And so it's given us, I think, some food for thought about how to move forward with that as well.
Yes, absolutely right. Mhm.
Yeah.
Thank you.
Thank you.
Thanks for all the questions. I really enjoyed responding.
Thank you. Thank you very much.